Okay, so good morning, good afternoon to everybody. I'd just like to thank the organizing committee for inviting me to speak at this fantastic webinar. I'm going to be talking about HIFU application in South Africa, and I'm going to be talking mainly about the management of fibroids. Just trying to see when my slides are not moving. It's not moving, just wait. I don't know why it's not moving. Can you hear me?
Yes, we can.
Yes, we heard you, Raymond.
I don't know why the slides are not moving. Can anyone give me some advice here?
You make a share screen?
Yeah.
Share screen?
It says I'm on share screen.
Yes.
Okay. Dr. Raymond, maybe you can escape first. Escape the presentation.
Let me just try here now.
Click ESC.
It was working 2 minutes ago when we tested it.
Yes, that's right.
Let me just stop the share here. Let me try it again.
Yeah.
Oh, I don't know why it's not doing anything now.
Still not.
Click on the slide. Click on the slide.
So how?
Oh, okay, let me do it that way. Okay, sorry about that. All right, so I work at Chris Hani Baragwanath Academic Hospital, which is the largest hospital in South Africa, and also in the Southern Hemisphere. And in fact, it's quoted in the Guinness Book of World Records as the third largest hospital in the world. We've got approximately 4,000 beds in the hospital. This hospital services the needs of Soweto, which is a black urban settlement bordering on Johannesburg, which is one of our major cities. And in Soweto, we've got a population of about 5 million people. So we service quite a big population. Just some pictures to show you what Soweto looks like. There's a lot of informal settlements. You can see the shacks with outside toilets, but there are also formal houses as well. So it's a combined settlement. My hospital is a government hospital, which is affiliated to the University of Witwatersrand, which is one of our major universities in South Africa. We are the largest training hospital in South Africa. The vast majority of patients that we treat at our hospital are black patients. We were also the first HIFU center in Africa. We got a machine in late 2015. And all the patients, most of the patients that we treat get treatment free of charge. That's just a picture of the entrance to our hospital. It's a very busy hospital, as I'm sure most of the African hospitals are throughout Africa. You can see there's always large queues of patients waiting, backlogs for theater, backlogs for clinics, very busy hospital. When we look at the healthcare system in South Africa, it's divided between private and public sectors. The private sector caters only for about 15% of the population. So the state, the government, take care of about 85% of the population. So these are all government hospitals, which we service the lower income groups. As I said before, most of the treatment is free. And these hospitals are chronically underfunded, understaffed, and overloaded with patients. The total population in South Africa is about 58 million people. And around about 50% of that is made up of black females, 29 million black females in South Africa. So if you look at the fibroid profile, we know that there's the prevalence of uterine fibroids is 3 to 5 times more common in Black women than in Asian or Caucasian women. So we have a huge problem with fibroids in South Africa. And the majority of our patients that we see in our gynae outpatients department are patients who are presenting with fibroids and the related complications. And I'm sure this applies to most African countries. If we look at the profile of our patients, as I said before, they're mostly all Black females. We have a big problem with obesity. We've got a high HIV positivity. Our patients are late presenters. And I'll go through each of these in more detail. We see a lot of young patients, infertile patients, and patients with extreme symptoms. In a study that was done in 2017, they found that by the age of 20, there's probably half of the South African women are overweight. And by the age of 45, this goes up to about 82%. So this impacts on traditional treatment of fibroids, operating on these patients. It's always a lot more difficult on obese patients with a lot more complications, wound sepsis, etc. Also, we have about a 25% positivity with HIV in our reproductive age patients. And again, this creates problems in theatre. There's always a chance that one of the doctors might get cut or a needle stick injury with transmission of HIV. So it is a problem when we're operating on these very big patients who are HIV positive. Another problem that we see in our African patients in South Africa is they present late. They always seek alternative forms of treatment before they come to us, whether they go to traditional healers, herbalists, or whatever. A lot of these patients are infertile and they desire pregnancy. So when they see a mass growing in their abdomen, they suspect that they might be pregnant, and then they don't come forward to be assessed. Patients also, it's a common problem with us. They don't come for routine checks. They only come in for a checkup when they've got some chronic problem. There's also quite a marked fear of hospitals and a fear of surgery. So because of all these factors, the patients present very late. And as a result, we see these big fibroid uteruses, multiple big fibroid uteruses. If you look at the MRIs, you can see multiple fibroids. So it's a problem. Another issue we have in our South African patients is infertility. Now, we've got a lot of different tribal groups. We've got at least 9 different tribal groups. And there's many varied traditions and cultural beliefs. And one of these is that in order for a lady to get married, she needs to be fertile. So there's a very strong desire for fertility. And another issue is that the greater the number of children in a family, the higher the social status of that family. So these patients want to preserve the uteruses. They don't want to have surgery and have hysterectomies. So they're very worried about going in for any kind of surgery. Also with socioeconomic issues, our patients, there's a very high unemployment rate. It's over 27%. So patients are very nervous about coming in for traditional surgery, which is going to take them off from work for at least 6 weeks. They're worried that, that when they get back, their job might not be there anymore. And it's also very difficult for them to get sick leave. So that's another issue why they are not keen to have traditional surgical management. So if we look at the burden of traditional treatment, which what I'm talking about here mainly is a laparotomy whereby either a myomectomy or a hysterectomy has been performed. If we look at the burden on the healthcare system of this kind of treatment, these patients need admissions to the hospital, and they're going to be in the hospital for quite a long time. On average, it's about 5 to 6 days. So there's a marked burden cost-wise on the state, having all these patients admitted, staying in the hospital for 5 to 6 days. Also, the wards are very overcrowded. They fill the wards. When we do these big operations, particularly the myomectomies, even with some of the hysterectomies, there's usually quite a marked blood loss. So we use quite a lot of blood products, and as we know, blood products are scarce. I think throughout the world they're scarce, and they're quite costly. So that adds another big expense to the hospital. And also we have a surgical backlog at any one time of around about 450 patients. So these are patients who are requiring myomectomy or hysterectomy. And these patients are going to wait from the time they book, they're going to wait at least probably about 8 months before they get to surgery. So in that time, the fibroids are going to grow bigger. They're going to have more symptoms. A lot of them will require blood transfusions. So it's a problem. So now if we look at the development of fibroid treatment over the years, as we mentioned in the beginning, it was the traditional form of management was a laparotomy whereby either a myomectomy or a hysterectomy was done. And this is pretty invasive kind of management. Can have problems, bowel injuries, bladder injuries, ureteric injuries. Patients develop marked adhesions post-surgery. So it's quite invasive. And then through the years, we've come up with sort of more minimally invasive kind of procedures. But now we've come up with something that's completely non-invasive, and that's HIFU. This is what our machine at Baragwanath Hospital looks like. We're not going to go into the details of how HIFU works. One of the other speakers is going to talk about that. Just to show you that the HIFU, this HIFU with the A in it here, that's the name of the company that developed this technology and who's developed this machine that we see down below here. And as you can see, their motto, treatment should minimize harm to patients. So we should be getting away from traditional kind of medicine where we're doing this invasive surgery. And our machine is the model JC200. So what are the healthcare benefits of HIFU? Why should we be using HIFU? Well, we are now doing these cases as day cases. So the patients come in the morning, they have the procedure done, they go home in the afternoon. So we don't have any hospital admissions anymore. So there's marked decreased costs to the state. They don't have these admissions. And also the wards are more manageable. Normally we would have at least half the ward will be filled up with surgical patients having non-urgent surgeries. So the wards are far more manageable. There's no general anesthetic given, so it frees up our theaters for more urgent cases. And because the treatment is completely non-invasive, there's no blood loss. So we don't have the necessity for blood transfusions anymore. So again, we're preserving our scarce commodities. And again, it's saving us quite a lot of money on the blood transfusions. As I mentioned earlier with the HIV transmission, there's no contact with the patient at all. It's completely non-invasive. So there's no risk of HIV transmission. So it's far safer for the whole medical team. And the actual procedure is very safe, and there's very low risk of complications such as bowel, bladder, ureteric injuries, which would then require further surgeries, further time in hospital, etc., etc. And what are the benefits to the patient of HIFU? How do they benefit from it? Well, again, as we mentioned, it's a day case, so they don't have to be admitted. So they get back home on the same day. There's no general anesthetic, so their recovery is much quicker. And also they return to work within a few days. So in terms of job security, they don't have to worry about losing their jobs. They're going to probably be away from work for 1 or 2 days as opposed to, say, 6 weeks. And because the treatment is non-invasive, the uterus is spared. If you were doing a myomectomy, there's a good chance that you would need to proceed to an emergency hysterectomy because there's uncontrolled hemorrhage, or by the time you've removed all the fibroids, you can't close the uterus. In this kind of procedure, we don't have to worry about that. The uterus is spared. The myometrium is not damaged. Because it's such targeted, precise treatment, the myometrium surrounding the fibroids is not damaged at all. So these patients, if they fall pregnant, they can have a normal vaginal delivery. They don't have to have a cesarean. Also, because it's non-invasive and there's no abdominal wound, the patients return to normal activities exercise very quickly. Within a few days, they could be back to their normal routines. And the other big factor is obviously there's no adhesions. Now, when we do myomectomies, we know that there's always big adhesions that develop post myomectomy. With this treatment, there's no adhesions at all. Also, there's no ionizing radiation with HIFU. So this treatment can be repeated. If we have patients who've got multiple fibroids and we can't treat them all at one sitting, we can treat them again thereafter without any problem. There's no danger from it. And because it's such localized treatment and no radiation, the ovaries are completely safe. There's no damage to the ovaries. So you don't have to worry, like with uterine artery embolization, you might get some damage to the ovaries. And also from a cosmetic point of view, women don't like big scars on the abdomen. So with this treatment, the abdomen is spared. So if you have a look at this picture here, you can see what the abdomen looks like after laparotomy, after laparoscopy, and after HIFU. There's absolutely no marks on the abdomen at all. If you just have a quick look at the recovery time following the different procedures, you can see that with the ultrasound guided HIFU, within 1 to 2 days, the patients are back to normal. They might need a little bit of analgesia, but otherwise they're fine. Whereas if they had a hysterectomy or a myomectomy, they'd be off for at least 4 to 6 weeks. So that's quite an important thing in terms of their recovery. I just want to quickly go through some of the South African results. And this is mostly on fibroids. We don't see too much in the way of adenomyosis. So I'm going to be talking here mainly about fibroids. To date, we've treated just under 500 patients. And you can see the age ranging from as young as 18 all the way up to 45 years of age. That's another thing that I forgot to mention earlier, is we're seeing a lot of younger patients. Now, routinely, patients with fibroids present around about the age of 35 or so. In our patients at Baragwanath, we're seeing patients as young as 18 who are presenting with quite large fibroids and quite severe symptoms. And also you can see there that the weight varies from between 43 kilograms all the way up to 115 kilograms. Abdominal wall thickness, we shouldn't go above 6 centimeters in terms of treating the patients. So there we around about 33 to 64 millimeters in thickness. Now we've treated a total of about almost 1,200 fibroids, of which 327 of the cases were multiple fibroids and 158 single fibroids. The rest is not important. The patients who we've treated, most of them, as you can see, present with dysmenorrhea and menorrhagia. Those are the two big problems. And then we see a lot of patients with anemia, HBs below 10. Infertility is another big problem. And then bulk symptoms like constipation, frequency of urination. Now, during the treatment, obviously this is done under conscious sedation. So the patients do experience some symptoms, which are of short duration. They get low abdominal pain like dysmenorrhea, which is normal. They can get some pain in the buttocks. They can get a hot sensation on the skin, and they can get some pain down in the legs. In terms of major adverse events, in the just under 500 patients that we've treated, the only thing that we've experienced so far are 2 cases of first-degree skin burns, which resolved spontaneously within a couple of weeks without any surgical intervention. We've had no bowel injuries, no bladder injuries, and no permanent nerve injuries. Now, of 500 cases that were going for surgery with major myomectomies and hysterectomies, we would have had a lot more serious side effects at surgery. If we look at what we do with our patients is before we start treatment and post-treatment, we work out a quality of life score. And then we do that. So if you look at the before the treatment, you can see they had a low score of about just over 35, indicating that their quality of life was quite poor due to their symptoms. And then at 1 month, then we check them again at 3, 6, 12, and 24 months. And you can see how the quality of life scores have increased. And by 2 years, it's almost up to 75. So there's a marked improvement in quality of life of our patients. If you look at the symptom severity score, the same thing. If you look before the treatment, the score is just below 60, which indicates quite marked symptoms. And then as we go 1 month, 3 months, 6, 12, up to 24, you can see how there's a marked improvement of the symptoms. So for our patients, there's a marked improvement in quality of life and the symptom severity, and they're very happy with it. If you look at the shrinkage rate, it's at 1 month already, it's about 31%, going all the way up to at 12 months, on average, about 73% shrinkage rate. In terms of fertility successes, we've had 16 cases. 8 patients are currently pregnant at the moment. We've had 1 4-kilogram vaginal delivery, and we've had 7 term cesarean deliveries. One of the problems here with our patients is once they fall pregnant, a lot of the time we lose them to follow up. They don't come back to us. They just continue with their gynecologists, where it's in private practice or at one of the clinics or one of the government hospitals. So our figures, we are sure, are higher than that. But of the ones we know, we've got 16. This is just a sort of baby gallery of some of the patients that have conceived following HIFU. Just quickly show you some of the cases we've done. Here we've got a 40-year-old lady before the HIFU. There's the fibroid there. And this is 1.5 months after the treatment. And we can already see that there's a shrinkage rate of about 27%. And what we actually look at here is the ablation rate, is to see how much of the fibroid we've killed off. And you can see the black area indicates that there's no uptake of contrast. And that shows you that almost 98% of that fibroid has been ablated. So we expect a lot more shrinkage to occur. Here's another case. This one is before the treatment. This is 4 months afterwards, and there's already shrinkage rate of about 63%. There's another case of this. This is just 23 days after treatment, and we can see already there's probably just under 10% shrinkage rate. There's another case. So, in conclusion, I would just like to say that from our perspective, HIFU has assisted in transforming women's healthcare in South Africa. It's made a huge difference to our patients. It's made a huge difference to the actual healthcare system. It's a safe and effective alternative treatment for uterine fibroids in our Black patients. From the patient's perspective, the important thing for them is that they're retaining their uterus, and therefore they're retaining their fertility. There's a quicker recovery. They're back to work much quicker. They can have normal vaginal deliveries. And from the health system perspective, because of there's no more admissions, the costs are reduced, the decrease in blood requirements, and there's a quicker access to treatment, which is also very important. As I mentioned earlier, patients are waiting up to 8 months to a year to get a surgical procedure, whereas with the HIFU, we are getting them done within probably a month. So from that point of view, it's working very well. So at the moment, as Prof. Rosie was saying earlier on, we've got 3 machines in Africa: Egypt, Nigeria, and South Africa. And hopefully we're going to get a lot more machines, because this definitely is a vitally important part of the treatment of fibroids, especially in our public hospital in the African setup. Thank you.